Good day to you. Let me take you to the presentation of these 5 minutes explaining to you literature review, developing an Stigma campaign for increasing of mental health awareness among nursing students in Indonesia. This content includes introduction, body, and conclusion. Let's go first to the introduction. Mental health issues are prevalent in all countries around the world. Most societies, as well as most health and social systems, ignore mental health and fail to provide people with the care and support they require and deserve. As a result, millions of people around the world suffer in silence, face human rights violation, or have their daily lives negatively impacted. One of the most significant barriers to demand for mental health care is the stigma associated with mental health conditions. People living with mental health conditions face deep-seated stigma and discrimination all over the world. Stigma is a major barrier to improve mental health services and safe care in the general population and the health sector. It can be found in homes, schools, workplace, communities, and even the mental health care systems. Negative attitudes toward patients with mental illnesses are common among health professionals and they contribute to poorer care quality and outcomes. Evidence for high and low income countries suggests that anti stigma intervention can improve public attitudes, reducing discrimination experienced by people living with mental health conditions. Anti-stigma intervention, particularly social context strategies, through which people with lived experience how to shape attitudes and action, can also reduce stigma and discrimination in the community. The purpose of this literature review is to find important concepts related to anti-stigma programs in nursing education. The themes identified include first, stigma in mental health. Second, stigma reduction strategies. Third, measuring tools to measure stigma. Fourth, communities' attitudes toward mental disorder. And fifth, students' attitudes and behavior toward people with mental disorder. Now we are going to body. The literature review is based on three electronic databases, Procus, PubMed, and Google Scholar, and spanned the years 2018 to 2022. In this article research, the keywords are mental health, stigma, and nursing students. Following a search, 128 articles were discovered, with 28 of them matching the inclusion criteria. The research was conducted in Taiwan, United States, England, Finland, Ireland, Norway, the Netherlands, Australia, Philippines, Brazil, China, Malaysia, Nigeria, Singapore, Indonesia, Pakistan, Nepal, Spanish, Pakistan, Santiago, Portugal, and Croatia. Article publication years include 2018 5 articles, year 2018 2 articles, year 2020 6 articles, year 2021 6 articles, and year 2022 4 articles. Several research methods were used in the 38 articles, including qualitative research for articles and two action research, qualitative for articles, namely quasi-experimental, 9 correlational descriptive, and 2 comparative descriptive, and mixed method 7 articles, semi-structured interview, focus group discussion, and questionnaires were used to collect data or self-reports. Intervention or development of anti-stigma programs in education is accomplished through a variety of methods such as lectures, courses, seminars, anti-stigma curriculum development, and learning strategies. Interview guides, in-depth interviews and focus group discussion, observation sheets, and questionnaires were used in the article. To assess stigma, several questionnaires were used: a modified attribution questionnaire, the perceived psychiatric stigma scale, and modified social distance scale, the attribution questionnaire AQ9, opening mind stigma scale for health care provider WHOHC questionnaire, the CAMI scale, social distance scale questionnaires and stigmatizing attitudes, the questionnaire on stigmatizing attitudes, the questionnaire on stigmatizing attitude toward mental illness, the AQ27E questionnaire, the community attitude toward the mental ill questionnaire, mental illness clinician attitude scale, or MICA4. The attribution questionnaires. Two versions of the attribution questionnaire have been developed and tested by Corrigan. The 27-item version AQ27 and the 9-item AQ9. The attribution questionnaires were developed to address non-stereotypes about people with mental illness. These 9 categories: first, blame; second, anger; third, pity; fourth, how; 5, dangerousness; 6, fear; 7, avoidance; 8, segregation; and the last, coercion. The AQ 27 provides a very brief image about Harry, a man with schizophrenia. The AQ 27 includes 3 test items that are summed for each of the 9 stereotypes. The AQ 9 are the single items that load most into the 9 factors. A scoring key is a variety of scores representing each of the stereotypes. Community attitude towards mental illness, or CAI scale. CAI is divided in 4 attitude categories, where each category contains of 10 statements. The 4 attitude categories are authoritarianism, benevolence, social restrictiveness, and community mental health ideology. Mental illness clinician attitude scale. Mental illness clinician attitude scale includes 16 item questions, which is used Likert scale: strongly agree, somewhat disagree, and strongly disagree. Now we are going to a conclusion. This literature review demonstrates that anti-stigma programs in nursing education are highly anticipated by both lecturers and students. Every nursing education institution can implement and develop anti-stigma programs. Anti-stigma development can be accomplished through a variety of strategies, including courses, curriculum implementation, both through the learning process and clinical practice. Development methods and instruments used are flexible, adapting to the condition and climate of nursing education institution. People with mental disorder have better attitudes and behaviors when nursing education institutions develop anti-stigma curriculum. These are references that have been provided. Thank you so much for your attention and have a great day.